Hello, my name is John Brisson, author of Fix Your Gut and Health Coach. Welcome to the Fix Your Gut YouTube channel. Today we're going to talk about the anti-reflux surgery Nissen Fundoplication and why we do not recommend it here at Fix Your Gut. Now, I myself suffer from silent reflux for 8 or 9 years before I realized that the main cause of my silent reflux was H. pylori dysbiosis, which I later tackled, and I am in remission. And for years I thought maybe it had to do because I had, hernia surgery. I've had a lot of abdominal surgeries. My appendix burst when I was a teenager. And I had my silent reflux somewhat under control. That I'd have to live with it for the rest of my life. I was glad, I was gladly mistaken about that. So I myself never considered anti-reflux surgeries because with all my knowledge, I knew that they are a risk that I was not willing to take. I've had plenty of surgeries beforehand. I have a lot of scar tissue in my digestive tract. I didn't want to add any more. So I just did the best I can to manage it. And I generally do not recommend anti-reflux surgeries unless they're absolute last resort and you have multiple tests showing that your lower esophageal sphincter fails to function properly. Even then, I would still consider them because of the risks involved. There are many different surgeries out there. We're going to cover them in later videos, but today I'm going to specifically speak about the Nissen Fundoplication surgery. So, when you have a Nissen Fundoplication performed, the top part of the stomach, which is known as the gastric fundus, is stapled around the lower esophageal sphincter or the lower part of the esophagus so that it's strengthened and so that reflux cannot get through the LES, which is the top part of the stomach, the sphincter that opens and closes. The lower esophageal sphincter is a sphincter that opens and closes to allow contents out of the stomach and to allow the food that you eat and the water that you drink to go down the esophagus into the stomach. Okay, so people with reflux, they have a weakened LES and they have increased abdominal pressure that forces the contents out of the stomach into the esophagus, and that's what we call what's the pathology for reflux. So when you have a Nissen, you kind of take the top part of the stomach and you wrap it around, you staple it to the esophagus to strengthen the lower esophageal sphincter. So that it hopefully can close better. So the first Nissen Fundoplication was performed in 1955 by Dr. Rudolf Nissen, which is where the name for the procedure comes from. And there is one of the main cited studies for Nissen shows that surgical success rates are about 73% after 10 years, which is remarkably high. But is that true? I mean, the study sample for the following study is 249 people. That's a pretty small study size. So there are many problems that gastroreflux surgeries, including a Nissen Fundoplication, can cause. Some of those problems are not reversible. And so some of the complications associated with issues are that reflux and regurgitation can happen after the surgery. Now, I know that Nissens are supposed to fix reflux, but sometimes they don't, because they don't really tackle the other underlying problem of reflux. Yes, they may reinforce the LES, which may become looser and weaker over time because there's no change really to fermentation or dysbiosis, which can cause increased abdominal pressure, which can cause increased reflux. But yes, reflux regurgitation are complications and side effects known of having a Nissen done. Something called gas bloat syndrome, which we'll get to what that is later. Delayed gastric emptying from vagus nerve damage. Gastroparesis, which is even further than delayed gastric emptying, is when the stomach doesn't really empty almost at all in some cases if it's severe enough. Weight loss, dysphagia, which is trouble swallowing, abdominal adhesions from the surgery. An adhesion is when parts of the intestinal tract and organs kind of stick together, and it can cause blockages. Difficulty or absent ability to vomit. Gastric dumping syndrome, gastric cardia syndrome, which is known as Romhelm syndrome, early fullness, dysautonomia, chest pain, and even death during or from later surgical complications, which is only about a 1 to 2% possibility per the studies. A Nissen Fundoplication can also become undone over time because, if you don't fix the underlying problem of most refluxes, which is increased abdominal pressure from dysbiosis fermentation, it'll weaken and it'll come undone. And so you have to go back in and have another surgery performed. And that happens about 10% of the people per the studies. Now, one of the things that we mentioned earlier as a complication of the Nissen Fundoplication was gas bloat syndrome. Gas bloat syndrome is where the stomach cannot correctly expel gas through burping through the lower esophageal sphincter because it is too tight. And in some cases, a person can't even burp or vomit at all, which can cause extreme pain because you got this trapped gas in your stomach that you can't release. Your stomach is just expanding, and it can cause a lot of pain. And so they'll try to give you things like simethicone to break the bubbles up, or sometimes you have to actually go in there and surgically relieve the gas. Granted, that's rare, but that does happen. Gas bloat syndrome has about a 41 occurrence rate, and people have had a Nissen Fundoplication done. And some people actually have it until the surgery is either redone to maybe give a little bit of slack more to the LES so it can open up properly to allow gas out, or reversed. Gastric dumping syndrome rarely occurs, and that's when the stomach dumps its contacts into the duodenum before complete digestion has taken place too. And since you're as soon as you eat your food, before complete digestion happens, it just dumps into the duodenum. You end up getting hypoglycemia sometimes, inflammation from improper neutralization of stomach chyme, because it's very acidic, and diarrhea. And so gastric dumping syndrome may cause, because when you're down there working in that general area, you may injure a nerve, like the vagus nerve, so it can cause some dysautonomia, some mistiming within the migrating motor complex of the digestive system, so it is a risk. Again, the surgery in of itself, the Nissen Fundoplication, it doesn't fix the initial reason why a person has reflux in the first place, which for most people, again, it's dysbiosis of the upper gut, which leads to increased fermentation, which leads to increased gas production, which leads to, reflux of contents going up and a weakening of the lower esophageal sphincter, which causes reflux. And since it doesn't, there are people where it comes back. Even though they had a Nissen done, their reflux comes back. And I've seen many anecdotal reports. A friend of mine used to send me from this Nissen Fundoplication, this anti-reflux surgery Facebook group, of people getting Nissens done. Now, granted, you could say people are more likely to report negative things than positive things, which I can believe that. But there's just stories after stories. I mean, hundreds, if not thousands of people over the years having issues. It's scary. That's why I would not recommend, I would only recommend a Nissen Fundoplication is if you can prove that there's no dysbiosis causing excessive fermentation and reflux. You can prove that the LES sphincter is completely not working at all. Then maybe I would consider not having a Nissen done, but have a TIF procedure, which we'll talk about in another episode. But that being said, I still do not recommend generally anti-reflux surgeries as a last resort. I actually coached a young gentleman a couple of years ago, had all the hallmark symptoms of H. pylori dysbiosis, ulcers, reflux, gastritis, everything. And the doctor, after a couple months of him being on proton pump inhibitors and nothing getting any better, and I said the surgeon just decided to go ahead and, the gastroenterologist decided just to go and do a Nissen Fundoplication. The kid was in his young 20s. There was no need for that. So he came to me and I said, you have H. pylori dysbiosis. Well, I got tested for H. pylori and came back negative. Well, sometimes it does, because H. pylori is a transient bacteria and it's hard to test for. It depends on many different test mechanisms. For example, if you get an antibody test in the blood, the H. pylori has ways of evading our own immune system, so that test comes back negative. So I put him on an anti-H. pylori protocol. Within 2 weeks, 1 to 2 weeks, no symptoms. Perfectly fine. That was his problem. And now he's going to have, unless, he later gets it redone, or undone, should I say, he's going to have to live with that surgery and the complications associated with it for the rest of his life. And it was unneeded. So, that's why I don't, recommend it. One last final quote I want to read about Nissen Fundoplications. The incidence of a postoperative failure is 2 to 30%, which 30% is quite high. The frequency of post-fundoplication paraesophageal hernia is 7%. And reoperation may be necessary if clinic response is not good. Reoperation frequency is 4 to 9%, but the fact that post-operative dysphagia is very high, which is trouble swallowing, is 33%, must be taken into consideration. Ascending migration of the fundoplication towards the thorax can be progressive and life-threatening of the patient. That's when fundoplication keeps moving upwards. Can cause Romheld syndrome. Other authors have reported reintervention rates of 1.8 to 10.8 for persistent dysphagia, trouble swallowing. So even though you look at the things for the Nissen Fundoplication and how well that they work, you'll see that the trends, the longer a person goes with the surgery, the more people had to go back on proton pump inhibitors. The more people had post-operative complications for Nissen. Gas bloat syndrome is very high. Dysphagia is very high. That's why I do not recommend the surgery. And again, if you have to have one done, I would recommend a TIF procedure, which is a transoral incisionless fundoplication. And I'll cover that in another video. There's also the Lynx procedure, which I do not recommend at all. There's also the Strata procedure, which may be better than the TIF, may not be. But that being said, if you are going to have a Nissen or type in a fundoplication done, not Nissen, then the transoral incisionless fundoplication is probably your best bet. And I would not have a standard Nissen done where they have to cut you up. You want to make sure. That it's laparoscopic if all possible, because you have a better chance of recovery instead of being opened up completely. And if you end up having to have any of these anti-reflux surgeries for whatever reason, make sure that you supplement, if you can tolerate it, glutamine afterwards, L-glutamine, about 10 to 20 grams. It may help you, recover and repair a lot better. So that's one of the recommendations that I can give to you. Of course, run everything by your doctor. Vitamin C supplementation may help too as well for the proper production of collagen that will lead to less scar tissue. That too, a couple of grams of vitamin C a day might also be helpful. As well as getting cold laser treatment and red light LED therapy, or even just exposing the wound to sunlight once possible, once it's safe to, for proper healing within moderation. Of course, you don't want to burn it if you're doing it to direct sun. All those can help recovery too as well. But yeah, I don't recommend the Nissen Fundoplication. I want to make that 100% clear. But if you have to have one done, again, any of the anti-reflux surgeries, the TIF procedure is probably the best one. I don't recommend the Nissen because it has many complications, including gas bloat syndrome, which has a 41% occurrence rate. Has a very high risk of dysphagia, as well as it doesn't correct the underlying issue of reflux, which for most people is bacterial dysbiosis within the upper gut that triggers unnecessary fermentation and reflux and a weakening of the lower esophageal sphincter. If you like this video, please like, share, and subscribe, and I hope you have a great day.